Hello guys, what's up? So I will be continuing with the ENT section. In the picture you can see many lines for the larynx, but I will not be illustrating all of them. I will be telling only the important ones that is needed for your NEET PG exam. So starting with the thumb sign on X-ray soft tissue lateral neck is characteristic feature seen in acute epiglottitis. टर्बन एपिग्लॉटिस फॉर ट्यूबरकुलर लेरिंजाइटिस मतलब कि टीबी लैरिंग्स में टर्बन एपिग्लॉटिस मिलता है. एपिग्लॉटिस बिकम्स टर्बन शेप्ड. गर्ट्समैन प्रेशर test is done for pubophonia. Most common vocal neutral is at the junction of anterior one third and middle one third. Vocal polyp most common site is anterior commissure. Now elective mutism. You will see many patients of elective mutism in OPD. Is a rare condition characterized by complete withholding of oral communication in the presence of normal laryngeal structure and function in response to traumatic event and or in extreme anger, often in child. Sulcus glottitis manifests in the form of groove along the length of one or both the vocal cords. 2% of juvenile laryngeal papillomatosis can turn to be malignant. Commonest site for Quincy is tonsillar upper pole. Acute retropharyngeal abscess, mind it, acute, present as lateral bulge in the posterior pharyngeal wall. मतलब जब आप एग्जामिन करेंगे एक एक्यूट रेट्रोफेरेंजियल एब्सेस के पेशेंट को, सो यू विल सी अ लैटरल बल्ज इन द पोस्टीरियर फेरेंजियल वॉल. मतलब मुंह के पीछे के साइड में एक लैटरली एक बल्ज मिलेगा. बट इफ यू आर एग्जामिनिंग अ केस ऑफ क्रॉनिक रेट्रोफेरेंजियल एब्सेस, देन यू विल सी अ मीडियन बल्ज, बीच में बल्ज मिलेगा इन द पोस्टीरियर फेरेंजियल वॉल. Excess soft tissue neck lateral view shows straightening of the cervical spine due to median bulge. To prevent injury to the carotid sheath, high abscesses are drained by putting vertical incision along the posterior border of the sternocleidomastoid and low abscess anterior border of the sternocleidomastoid. Means can be asked. That is a clinical based question. Less chances but can be asked. Quincke's disease is acute edema of the uvula. Most common manifestation of infectious mononucleosis is tender enlargement of cervical lymph node with sore throat, fever, splenomegaly. Means mostly you need to remember is that the most common manifestation of infectious mononucleosis is tender enlargement of cervical lymph node. Ortner syndrome is due to pressure compression of recurrent laryngeal nerve by atrium due to mitral stenosis. No lymph node spread is seen in carcinoma glottis. Earliest symptom in case of carcinoma glottis is hoarseness and latter followed by stridor. But in carcinoma subglottis, the earliest presentation is stridor. Means the patient present to you will be stridor and then followed by the hoarseness. Most common site of why this is so, because in glottis the vocal cords lies and so the first earliest symptom will be hoarseness. Most common site of metastasis in case of carcinoma larynx is lungs. Siemens law, an important law. There are not many laws in ENT, but the Siemens law is important one. Siemens law states that in all the progressive organic lesions of recurrent laryngeal nerve, the abductor muscles of larynx are affected before the adductors. Abductors are affected before the adductors. It also states that the paralysis of adductor type is functional in origin. Steeple sign, other very important sign besides the thumb sign, seen in laryngotracheitis, in which radiography reveals a narrowing in the subglottic lumen. Now continuing with the nose section. So nose is also important as regard to your ENT is concerned. So the question is typically asked from different sections. The important one in nose is the angiofibroma. So adolescent male, typically 14 year, with a complaint of nasal obstruction, unprovoked, spontaneous epistaxis. Mind the points: unprovoked, spontaneous, plummy voice. The diagnosis is angiofibroma, and investigation you will ask the patient to do is CCT of the nasopharynx. Lateral tomography in angiofibroma shows antral or Haller-Miller sign. So this is the characteristic sign seen in the angiofibroma. Nasopharyngeal carcinoma shows Trotter's triad, and the investigation of choice for nasopharyngeal carcinoma is MRI. MRI. So Trotter's triad is seen in nasopharyngeal carcinoma, unilateral middle ear effusion, elevation or immobility of the soft palate, and the earache. So fifth nerve is involved here, trigeminal nerve, and the palatal palsy is there, and middle ear effusion is seen. Trotter's triad typically for nasopharyngeal carcinoma, investigation of choice is MRI, and it is a very radiosensitive tumor, nasopharyngeal carcinoma. Now, painless cervical lymphadenopathy is the most common manifestation of the nasopharyngeal carcinoma. While if you see for angiofibroma, the most common symptom is epistaxis, as it is a very vascular tumor. So, biopsy is biopsy is contraindicated in angiofibroma. I have made a separate video for the differences of angiofibroma and nasopharyngeal carcinoma. 7 points regarding them you need to know. You can refer to that video. TB causes perforation of the cartilaginous septum. Syphilis causes perforation of the bony septum. Osteomeatal complex in the nose is also known as Piccadilly's circle. Maxillary sinusitis is characterized by evening headache, while frontal is also known as office headache. Postural test is done for wisp sinusitis, frontal maxillary ethmoid wisp sinusitis for maxillary sinusitis. Lawrence-Lager's operation is for atrophic rhinitis. Pott's puffy tumor is subperiosteal abscess subsequent to frontal sinusitis. Woodruff's plexus is found in the lateral nasal wall posterior to the inferior meatus. Tracheostomy reduces dead space by 30 to 50%. Apnea following tracheostomy is treated by 5% CO2 and 95% O2. Hebra nose or tapered nose is seen in late stages of rhinoscleroma. Leprosy involves inferior part of the nasal septum and anterior end of the inferior turbinate. Sluder's neuralgia or anterior ethmoidal nerve syndrome present as pain